Senator Beatrice, in an unusual show of courtesy to the senator, the honorable senator, you may now proceed to take your 9 minutes. Now that you're in the House, proceed. Please call out that motion again for Senator Beatrice to know which motion it is.
Order number 15, motion, establishment of national teaching and referral hospitals in Kenya, resumption of debate.
You had 9 minutes, Senator Beatrice.
Thank you, Madam Speaker. Madam Speaker, I was on the floor to second this motion by Senator Mwaruma on the creation of referral and teaching hospitals in our region. So, Madam Speaker, the only current referral hospitals we have are Kenyatta, Moi, Mathare, Kenyatta University, and the National Spiral Injuries Hospital. And Madam Speaker, the reason why I'm going to second this motion is that every Kenyan needs to access certain referral services that is domiciled in this referral hospital. Madam Speaker, I already even gave an emphasis and I spelled out the challenges some of us have had to go through from our regions, as our people have to travel all the way to Eldoret to the Moi Teaching and Referral Hospital. A number of patients, Madam Speaker, have died on the way to the hospital because of the distance. And so, Madam Speaker, because we want health services closer to our people, and especially the referral services that are required for our terminally ill, for the specialized services that are in this referral hospital, it is only right that all regions, the Ministry of Health creates these hospitals in most of these regions. And Madam Speaker had indicated all those regions as I introduced my secondment. And so, Madam Speaker, I second this motion.
Thank you, Honorable Senator. Honorable Senators, I propose the question that aware that Article 43(1)(a) of the Constitution of Kenya provides that every person has the right to the highest attainable standard of health, including reproductive health, noting that in Kenya we have 5 national teaching and referral hospitals with Kenyatta University Research and Teaching Hospital in Kiambu County and Moi Teaching and Referral Hospital in Eldoret, Uasin Gishu County being the only ones outside Nairobi County, concerned that the bed capacity, medical equipment, and human capital in these national teaching and referral hospitals are not sufficient to absorb all the patients seeking specialized treatment. Further concerned that many Kenyans with critical health conditions travel long distances in order to access specialized services in Moi Teaching and Referral Hospitals in Eldoret or Nairobi, where the other 4 national teaching and referral hospitals are located, leading to high cost of travel, augmented disease, and in some cases, deaths along the way. Now, therefore, the Senate urges the Ministry of Health to establish national teaching and referral hospitals in the coast, eastern, northeastern, Nyanza, and western regions, and fully equip the national teaching and referral hospitals with modern equipment, medical supplies, and personnel, and 2, the county governments to allocate more funds to their respective health dockets to adequately facilitate their county level 5 and level 6 hospitals in order to enhance provision of critical health services to reduce the demand for such services from the national teaching and referral hospitals. Senators, you're now free to contribute, and I'll call Senator Cherarygie Samson to make his contribution to this motion.
Madam Speaker, thank you very much. I want to pick it from where Senator, the distinguished senator, the seconder, left at, I think this motion is very critical. Madam Speaker, we have to agree that the issue of health is a basic human right. Madam Speaker, they say a healthy nation is a wealthy nation. Madam Speaker, that is what is important. And therefore, it is in the interest of any nation to have a healthy population. And therefore, Madam Speaker, I support this motion that we need to bring health closer to the people. Madam Speaker, number two, when you look at the fourth schedule, one of the trademark or one of the functions that has been devolved to county governments is the issue of health. But as we talk, Madam Speaker, health is in deplorable state in all across counties. In fact, the worst being Nandi County, Madam Speaker. When you walk to Kapsabet County Referral Hospital, which should be level 5, there are no drugs. There is poor hygiene conditions, Madam Speaker. The infrastructure is falling apart. There is no functional mortuary, Madam Speaker. The projects within the health sector, and when the governor appeared on Friday, he could not give us answers on the Stol Kapsengere Hospital in Terik Ward in Aldai Sub-County, the Stol Kobujoy Health Center, which is a stone throw from his house, the Stol Nyayo Ward in Chepterwai Hospital that has told, Madam Speaker, even the mother and baby unit that is within the compound of Kapsabet County Referral Hospital, Madam Speaker, is told. The only thing that changes in that mother and baby unit is only the change of paint that is being painted white and other colors, Madam Speaker. So the infrastructure situation is pathetic. Madam Speaker, the only concern we have with counties, and there is a confusion, is that counties should not confuse the infrastructure of hospitals vis-a-vis the service delivery. Brick and mortar will never replace the functionality and service delivery. Madam Speaker, the issue of provision of health is very critical. And that is why I said, even when we celebrate 15 years of devolution, where 4 trillion Kenya shillings has been dispersed to counties, the situation in our health sector is deplorable. Go to Garissa County, Madam Speaker. Come here to Nairobi. Go to Nandi. Go to Kiambu, Madam Speaker. Go to Migori. Go to Homa Bay, Madam Speaker. Go to Kisumu. The situation, even in Murang'a, the situation of medical health provision is still a problem in most of those counties, despite 4 trillion Kenya shillings, Madam Speaker. Madam Speaker, for us, I don't see colleagues who are with us in the last session. We had even what we call medical equipment supplies, the mess. In fact, instead of growing the accessibility of diagnostic, like issue of dialysis, issue of oncology services, issue of kidney, Madam Speaker, that is dialysis, issue of ultrasound, Madam Speaker, in our hospitals, the mess program became a mess in our county hospitals and sub-county, Madam Speaker. So this issue is timely that we need to sit and agree on how we can ensure each and every county has referral hospital. And Madam Speaker, we have done this before. We have said, Madam Speaker, that every county must have a university. Now we are saying every county must have a county referral hospital that is run and managed by the national government, Madam Speaker. And therefore, Madam Speaker, I agree with this motion that we are only 2 hospitals. That is Moi Teaching and Referral Hospital in Eldoret and Kenyatta University Research and Teaching Hospital that is in Kiambu County. Madam Speaker, we need to propose, and the national government should work with our counties. For example, I want to thank the President, Madam Speaker, that Cherarygie Oginga Referral Hospital in Kisumu has been gazetted, is now a referral hospital. Courtesy of broad-based government, Madam Speaker, and we should be proud of such achievements, Madam Speaker. Number 2, Madam Speaker, we need in the spirit, we need to make, and I'm happy that the national government has taken over the construction and completion of Kakamega County Referral Hospital. That one should also be referral, because Moi Teaching and Referral Hospital is being overwhelmed. If the Cherarygie Oginga Referral Hospital becomes functional, Madam Speaker, it will be decongest Moi Teaching and Referral. And to give facts to Moi Teaching and Referral, because I come from that region, you go, Madam Speaker, you find even people coming from Murang'a, your county, people coming from Mandera to seek services in Moi Teaching and Referral, which is overwhelming the system of teaching and referral. Madam Speaker, to give you numbers of Moi Teaching and Referral Hospital and also give you KNH, Moi Teaching and Referral Hospital, Madam Speaker, it has 2,000 admissions inpatient It has 3,000 walk-in patients per day in Moi Teaching and Referral Hospital in Eldoret. Madam Speaker, I want to thank the President also, in the spirit of broad-based government, that yesterday there was a groundbreaking of 20 billion new ultra-model Moi Teaching and Referral Hospital in Eldoret, Madam Speaker. This is to expand and meet the ever-changing needs in Moi Teaching and Referral Hospital, Madam Speaker. The Moi Teaching and Referral Hospital in Eldoret, I've said they have 2,000 inpatient bed capacity, Madam Speaker, 3,000 walk-in daily. Madam Speaker, I'm aware they used to get 8 billion Kenyan shillings, but 2 billion, Madam Speaker, was cut and it became to 6 billion. Madam Speaker, the Moi Teaching and Referral Hospital of Eldoret collecting 5 billion in own source revenue. We need to encourage them under Facilities Improvement Act to even, I expected by now, that Moi Teaching and Referral Hospital, in their income on all source revenue, they must collect, Madam Speaker, up to 10 billion, so that they can break the gap, Madam Speaker, they can bridge the gap, Madam Speaker, of the underfunding that was cut in the previous budgetary allocation. Madam Speaker, I want to challenge the management from the CEO, the chairman of Moi Teaching and Referral Hospital in Eldoret. That hospital, the services have gone down. The place is dilapidated, Madam Speaker. The place is very dirty. And also referral system has failed in Moi Teaching and Referral Hospital in Eldoret. I want to challenge the CEO and the management, the chairperson of Moi Teaching and Referral, to improve. I am aware there are challenges of understaffing of nurses, Madam Speaker, because they need more than 2,000, but they have less than 1,000 nurses. Those are issues that they can fix, but they must improve on the service. We need quality service. Even in Kenyatta National Hospital, you remember the case, Madam Speaker, of a doctor that was an intern or a doctor that was here in Kenyatta National Hospital. When it reached a point of seeking medical, he could not be treated in KNH, Madam Speaker. There are so many problems that KNH is facing. Although there are good problems, there are good solutions that they have given. I saw they did the first reconstructive of face surgery that was done by KNH, Madam Speaker. I am proposing that despite the challenges that Kenyatta National Hospital is facing, we need the management and the CEO to up the game to ensure KNH provides best of the best services across in the Kenyatta National Hospital. Madam Speaker, we need to upgrade Coast General Hospital to be a referral hospital, Madam Speaker. For a start, I know there are not enough funds, but I want to appeal to government. Let us transform Coast General Hospital to become a national referral hospital to take care of Coast Region. I am proposing that Garissa County Referral Hospital be now taken to National Referral Hospital together for Northern Kenya, Madam Speaker. I am proposing now Cherarygie Referral Hospital has been gazetted. It's now a functional, its independence, Madam Speaker. Another one is Kakamega. I have proposed Kakamega County Referral Hospital to be Kakamega Referral Hospital. Madam Speaker, for the Mulima, or the famous Murima, I am proposing that Otaya Hospital or Aini in Nyeri be now upgraded to National Hospital so that it can take care of the Murima region or Mount Kenya region, Madam Speaker, where you are the proud daughter of the House of Mumbi from Muranga, and we are proud of what you are doing as the SG Emeritus of UDA. Madam Speaker, I propose Katundu Hospital be now upgraded to referral hospital to take care of the central region, that is Katundu, that is Kiambu County and Muranga County, Madam Speaker. And also propose Turkana Hospital, County Referral Hospital, to take care of the northern part, including Marsabit and Turkana, so that each and every Kenyan can access, Madam Speaker. Madam Speaker, I know the funding might not be sufficient to establish every county together referral hospital, but that should be the blueprint of providing medical care so that we don't run afoul. Madam Speaker, as a senior lawyer in this country, you know, right to health or medical services is a human right, it's a basic right. You know, there are basics. There is food, shelter, and as you said, clothing. Food, shelter, there are normally three. I'm forgetting one. Food, shelter, and the other, Madam Speaker, and housing. And now we should add that health, Madam Speaker. We need to add that it's a basic human right. Madam Speaker, on the issue, and therefore, Even as we talk about SHA, I've had people, and we were discussing a good topic, Madam Speaker, in conclusion, because my light is on, I'm winding up, is that the SHA, I have had the situation, SHA is working. Why, if SHA is not working, why are 30,000 Kenyans registering daily for SHA? Madam Speaker, more than 20 million Kenyans have registered for SHA. Madam Speaker, the reason our mothers are detained, and I wish our colleagues were here, Madam Speaker, and you are a mother, Madam Speaker, the reason most mothers are detained in our hospitals is because of the following. One, they are underage. Two, some of them are aliens, Madam Speaker. Three is lack of proper documentation. And we should put the blame where it lies. The Migori County government has failed. Nandi County government has failed, Madam Speaker. Nairobi County government has failed. Health is devolved. SHA is working, but the health in counties is not working, Madam Speaker. We should get those two distinctions. I have met Kenyans of success stories that when they went to hospital and the bill came out, SHA took care part of it. And I want to challenge people who are saying SHA is not working. Give us an insurance that pays 100% of your medical cover. Even Parliament here, Madam Speaker. The Parliamentary Service Commission, dental cover, Senator Eddy, covers only 75,000. So if today you fly to Turkey or to America and put teeth braces of gold, which is 200,000, Parliament will not cover. Because the limit is 75,000. So let's stop lying to Kenyans. There is no medical cover that will give you 100%. I don't know anywhere in this world, even the Obamacare that was in America, even in medical care, even in insurance law, the medical insurance does not cover 100%. SHA is a success story that will transform universal health coverage in this country. I want to challenge mothers who have been detained that they need to ensure that they, and I'm happy the President has said Kenyans who are not able to pay, they can register, Madam Speaker. And the CS of health is well guided. Madam Speaker, I want to challenge that our mothers should have proper documentation. But let us put the blame where it lies. Our county health function in all counties has failed. It is not SHA that has failed. The governor should tell us why our mothers are being detained in hospitals, in Migori, in Nairobi, in Nandi, in Mombasa, in Murang'a, Madam Speaker. They should tell us why our mothers are being detained. And I want to say, people are saying we should go back to Linda Mama. Not true. We have now Linda Jamii, Taifa Care, that ensure, Madam Speaker, even the natural delivery is now 10,000. Before it was 8,000. The cesarean section delivery is now 30,000. And our Mabi Senator Eddy is excited because he is here to give birth. Because these are the people, Madam Speaker, when they get married and get babies, I can assure Senator Eddy, and I want to encourage him to get married as soon as possible and start getting children. You will appreciate the role of SHA. Because if it is natural delivery, 10,000. If it is a CS, it's 30,000, Madam Speaker. Unless he can contravene what I'm saying. But I want to challenge the young people outside there. Don't fear to get married. You are being taken care of by SHA. We shall ensure, and I'm happy, Madam Speaker, I don't know whether you know you hosted us sometimes back when you were giving out your daughter. I know she can attest to the functionality of SHA. And the Bible commands us, for us who are Christians, go ye into the world and give birth and populate the world. And SHA will take care of the bills. Madam Speaker, with those many remarks, to congratulate and say this motion is timely so that I can allow my colleague and listen to his brilliant submissions to Senator Eddy. But I want to caution him in future, when he's discussing a senior leader like me, senior politician, he should choose his words carefully. Because I had him in another forum, not, Madam Speaker, on a lighter note, he should choose his words very careful. Because I'm a senior leader, I know more than he does. Madam Speaker, with those many remarks, I support this motion, and let us give help to each and every Kenyan, and SHA is working. I thank you.
Thank you, Senator Cherarygie. I'll now give a chance to Senator Eddy Okech to give his contribution and reply to that very serious banter sent your direction by your colleague and maybe agent, Senator Cherarygie.